Good afternoon, everyone. My name is Pradeep Goyal. I'm the CEO of SolveCare Foundation. It is an honor and a privilege to be presenting at HIMSS Saudi Arabia 2018. I had hoped to be present in person, but logistics forced me to communicate with you by this video. Over the next 20 minutes, I want to introduce you to a personal and a professional journey that brings us to this point where we, as SolveCare, are working on delivering healthcare in a completely different way using blockchain as the underlying technology. Before we get started, a little bit about how I got into healthcare and blockchain. Many years ago, as a young man, I started a software company that became a key vendor to most of the major insurance companies in the United States. And from there, I got invited to work with Presidents Bush and Obama on their key initiatives. I learned a lot over the years, both in terms of how patients, doctors, insurers, employers, hospitals, and government agencies communicate, collaborate, and coordinate, and how it can be made better. As the blockchain technology emerged, it became clear that many of the systemic and endemic problems of healthcare can be rethought and addressed differently using blockchain technology. Why blockchain, and what does it bring to healthcare? The first thing is that in healthcare, most of the systems and processes are centralized. The patient, the doctor, the employer, even the government agency is typically outside looking in, trying to figure out how healthcare is working, how it is being coordinated, who's responsible for what, and who needs to get paid for what. Using a distributed ledger technology, we can rethink this entire relationship model between all these key stakeholders. Instead of having processes determine care, we can actually build a patient-centric approach that puts all the processes and people around the patient, as opposed to patient being a beneficiary of healthcare. We can decentralize processes. We can delegate authority to patient and doctor and other stakeholders. And we can bring transparency and visibility for all the stakeholders so we can measure healthcare, we can coordinate healthcare, we can manage and administer the healthcare processes, and we can ensure that the right person gets paid the right amount at the right time for the right reasons. With that background, SolveCare has built a complete healthcare delivery and administration platform with blockchain as its underlying distributed ledger. The platform consists of several key modules that really make blockchain accessible to a 9-year-old child or a 90-year-old grandmother and everybody in between. In the hands of the patient or the doctor or the insurer or the employer or the medical transportation driver or the nurse is Care Wallet. Care Wallet is a standardized platform through which I can access all the content and capabilities of the chain underneath. I never have to learn how to use the blockchain. I simply use the Care Wallet, and based on my roles and based on the function I perform, appropriate care cards appear in my Care Wallet. If I'm a patient, I will see a different set of cards than if I'm a doctor. And if I'm a nurse, or if I'm a specialist, I will see a different set of cards. These cards can be issued by the government agency, they can be issued by the employer or the insurance company, or even by the clinical research organizations who are giving me best practices and guidelines on how to treat a certain disease. The next thing in the wallet is Care Coins. These are digital tokens that are programmed to administer and pay for healthcare according to the appropriate regulations and guidelines of US or Saudi Arabia or Asia or wherever we are implementing the system. Basically, it is automated money that is programmed to deliver healthcare payments to between all the stakeholders that hold Care Wallets in their hand. All of this is built on a relationship-centric model of healthcare, and we implement these relationships through Care Protocol. The idea is very simple but very powerful. I, as a patient, have relationship with my doctor, with my specialist, with my family, with my employer, potentially with my government agency, and many other stakeholders. But I need to coordinate my care only across these handful of people. Not every doctor on the planet, not every hospital in the world, but the one doctor that I see and the one hospital where I get treated, and so on. So I can create a set of relationships around me using my wallet that pair my wallet to other wallets and create a patient-centric network. And these relationships and these pairings, like Bluetooth pairings, are defined on Care Protocol that uses blockchain for coordinating all these wallets and keeping them in sync. And finally, we all know that healthcare data is very valuable, very confidential, and must be managed, controlled, and audited. So Care Vault lets me manage and separate content that needs to go on the chain and publicly available across my network, and data that only I can see or only I have access to, or only give access to those who need and have my permission to see that data. So between these components, we have addressed practically every use case in healthcare between patient, doctor, specialist, lab, pharmacy, employer, insurer, and other key stakeholders. When you look at it from a perspective of how the Care Wallet delivers better care, I as a patient can exchange my plan information, my eligibility and availability information. The doctor can exchange with me their availability data. I can submit my medical records to them, and they can deliver prescriptions and care summary document to me, and so on and so forth. And all that interaction between us can be exposed to those parties who need to see, such as my insurance company or my government agency that is paying for or is trying to administer my care and ensuring that I'm getting the best possible care. And if necessary, we can transact between these wallets using coins in a peer-to-peer payment model, which can then be redeemed by a central authority as needed. There are many such use cases, and over the next 10 minutes, I'm going to walk you through many use cases that we are currently implementing both in US and around the world. So let's take a look at the type of use cases you can implement using blockchain as a coordinated distributed ledger and a powerful combination of protocol and wallet and cards sitting on top of the chain. As an insurer, in the US we use the term payer, but as an insurer, I can issue enrollment card to my entire population of membership and ask them to enroll using this card, and thereby eliminate the need for much of the paperwork and bureaucracy that goes into getting members into my plans. I can issue my bills and receive member-submitted claims for payment for medical care. I can also do premium collection both from the member and from their employer or other third-party participants in the cost of care. I can send explanation of benefits, and I can handle things like change of address or adding birth of a child or divorce or sickness, and so on and so forth. As a government agency, I can implement population health management and track certain disease conditions, outbreak of certain epidemics, influenza, and so on. I can track how the wallets are behaving in terms of appointments and how long it takes from the time when the patient requests an appointment to when they can actually see a specialist. I can track quality of care around cancer, diabetes, hypertension, weight, and all the other lifestyle diseases and chronic diseases that are a huge cost and a huge impact on our society. As an employer, I can track how my employees are utilizing care. What are when do they need my assistance? When we need to send them in for preventative care so they don't get sick. And when they do get sick, how do I get them to go see the doctor on a timely basis? As a physician, the wallet is designed to reduce tremendous amount of friction and cost and waste for them. From a point of view of appointment setting and scheduling and verifying my identity and verifying me as a patient and what insurance I have and what benefits I have, these are all administrative processes that hurt the physician in terms of their time allocation. And from a consumer perspective, the benefits are extremely evident. I can submit my request for an appointment on the chain and have every available physician's wallet respond to it and tell me when they are available, rather than me calling 10 physicians to find the one who is available tomorrow. The idea in general is to allow a patient and their wallet to link to the appropriate wallets on the chain that create a patient-centric network. That allows me as a patient to understand, participate, contribute, and manage my own care, but so can other nodes on the chain. As a government agency, I want to ensure that my citizens are getting timely and appropriate access to care, that my physicians in the society are delivering the right care at the right time for the right amount of money, and that we are getting the results we want, which is getting the patient out of the hospital, back on their feet, and back to work. So as a government agency responsible for the care of my population, I need visibility into how the patient is being handled, whether it is by the doctor, the specialist, the hospital, the lab, the pharmacy, and what I can do to implement good policy to sponsor the right behavior and pay for the right results. By being a node on the chain, I can then see access to these various different events without necessarily having to read all the data related to those events. We'll talk about that in a minute. Similarly, if I'm a specialist, I need to know who is being referred to me and why, and what I need to do to ensure that post-visit, their care continues in the hands of a primary care physician and there is no break in the continuity of care. As a lab, I need to be able to ensure that the test results that I have delivered, that I have created, are delivered to all the stakeholders, the patient, the doctor, the specialist, the family members who are involved in the care, without me having to coordinate that activity. So this chain essentially creates a much more efficient ecosystem where we can have all the parties stay in sync without having to lose control over patient privacy, patient security, and timeliness of care. So what we are looking to do over the next few minutes here is to share with you some of the very compelling use cases that we have already launched in the market in the US and Canada, and we are moving towards Middle East next, which is one of the reasons we are very keen to present to you all how care can be coordinated, how care can be administered, and how care should be paid using a platform like ours and using blockchain as the underlying technology. 5 key areas where we are focused on in terms of use cases are disease management, patient-provider interaction, physician reimbursement, reducing and eliminating fraud, waste, and abuse from the system, and measuring and paying for performance rather than for services. So first use case I want to share with you is that of appointment setting. As a patient, when I'm sick or when my child is sick, I am very interested in finding the physician that has the right skill set and, more importantly, has the right availability in my vicinity or in my child's school's vicinity where I can take him in for care as soon as possible. So instead of downloading a directory from the web or doing a Google search, I can post a request for availability of a physician of a certain kind on the chain. And every wallet of a physician that is registered on the chain can automatically or manually respond to my request, sort of like Uber request for a ride. Every available car in my vicinity responds with, I have availability now, or I have availability tomorrow at 9 a.m., which is when you want to bring him in. So given my preferences and my needs, the request event, when it hits the chain, is processed by every authorized wallet, and that wallet responds back with a scheduling availability card, and I can pick the time immediately, confirm my reservation, and automatically send my plan benefit or eligibility card informing the doctor which insurance company I'm insured with, what is my policy number, what's my benefits, my out-of-pocket expenses and responsibilities, what's my BIN number, and so on and so forth. And the objective here is that the physician, in accepting the appointment with me, has also received all the necessary consents that I need to give to be treated. So when I show up at the doctor's office the next day, I don't have to do any paperwork, and the doctor doesn't have to do any paperwork. A second use case further along this is the eligibility. As a doctor, if I know that the patient has insurance, I expect that I will collect some of the payment up front, the other payment I will collect later on from the insurance company, and I need to have all the eligibility information. How much can I bill? Who do I bill? how much do I need to collect from the patient at the point of visit, and so on and so forth. In an insurance paid model, either the insurance company will pay the doctor or the insurance company will pay the patient, or in some cases will pay both. And we need to have that information exchanged between the patient and the doctor in real time, but this information is only available from the insurer. So having an insurer issued eligibility card allows me, the insurer, to eliminate the need for the patient to call me, for the doctor to call me, for them to call each other, for them to call me after they have seen each other, so to check on who to bill and how to bill and when to bill. In my personal experience, when I was CIO of a Blue Cross Blue Shield, we had an army of people on the phone simply answering the question, can I go see the doctor? Can I see this patient? How much should I charge the patient? How much should I charge you? And we were continuously addressing this problem, and often there was a human error involved in misinformation and incorrect information being shared or used, resulting in a lot of pain and suffering that was avoidable. Having a blockchain-based eligibility gives all three of us, me the insurance company, you the doctor, and the person sitting next to you, the patient, to interact with each other in a certified, verifiable, digitally signed way where there is no ambiguity as to who said what and who authorized what. So if there is a problem later on, we have absolute and instant resolution versus the long drawn process of appeals that we go through today. Another exciting use case is medical transportation. I'm an employer. My employee tells me that he or she has an appointment to go see the doctor and needs to see the day off. I lose the entire day of my employee's time because they need 2 hours to go see the physician. I can sponsor. First, I need to verify they have an appointment. So I can see or have the employee send me their appointment card. And in return, I can issue a transportation card with them, which essentially gives them a Lyft or an Uber ride from my office to the doctor's location and pick up from the doctor's location back to the office. And the entire process takes 3 hours versus a full day. I'm giving my employees a benefit which they appreciate, which is that they're getting a comfortable, safe, and convenient ride from the office to the doctor and back. And I'm getting the benefit of a happier employee and a healthier employee, because not only did they not miss their appointment, they actually went. I also didn't lose extra 5 hours to their need to go see the physician. And the physician knows for sure that the employee is going to show up, because as soon as they get in the card informs their wallet that the patient is on their way. Many physicians struggle with the amount of revenue they lose, which can be as much as 20 to 30% with the patient not showing up for appointments. And patients suffer because they don't get the care they need on a timely basis, resulting in higher disease acuity, more cost, and ultimately worse outcome for everyone. And as an employer, I'm giving them time off with the hope that they're going to go see the doctor, but they don't always do that. So it creates a lose-lose-lose scenario. And having a subsidized managed transportation benefit keeps me, my employee, and their doctor fully coordinated. You can change the name employer with government agency and say, we want to get all our cancer patients in for regular checkups. So we want all the pregnant women to come in for regular sonograms. Based on the population's need, truly focused, targeted use cases can be implemented where we make sure that our patients get the care they need and they don't miss out on appointments because they don't have access to appropriate transportation on the appropriate day at the appropriate time. One very exciting use case we have built is around influencer healthcare. And what that means is I, as a patient, am much more likely to do the right thing to get myself well if people I care about and people who care about me are involved in my wellness. I'll give you an example. My mom lives far from where I live, and we always call each other every morning, and I ask her, how are you doing? And the answer is, I'm fine, which we know is not a complete answer. What I really need to know is she getting better, or is she getting worse, or is she stable? Is her headache or her back pain that she suffers from requires intervention, or are we right now on a stable condition? So we have created this notion of influencer healthcare where I can issue or receive from my wallet, how are you feeling today card, which can be issued to me by my daughter who has concerns about my struggle with allergies during spring and fall. And I am required to answer specifically the questions that need to be answered every day. Is your allergy getting worse or is it getting better? Did you sleep well? Are you sneezing? Are your eyes watering? Have you been taking your allergy medicine every morning as you should? Those 5 questions take me 5 seconds to respond using a very visual interface. And that creates a care ledger that is not only visible to my daughter and my wife, it's also visible to my physician. It's also visible to other people I have given access to. And if my condition seems to be regressive, not progressive, my physician can automatically send a scheduling card to me saying, I want you to come in next Tuesday or Monday or Wednesday because it looks like we need to do something. You are struggling with allergies more than normal. You can apply the same scenario to clinical depression, to cancer, to diabetes, to any chronic disease. I can use this card as a doctor to check on a patient who I did surgery on last week. So I can see if their surgical wound is improving or not improving. And that allows us to essentially implement a social approach to healthcare, where again the chain is used to coordinate and track and react to health conditions getting better or worse. We are implementing How Are You Feeling Today card for a group of populations right now. First, around post-surgical discharge from a hospital, around chronic diseases like diabetes, hypertension, and most interestingly and specifically around people who are at risk of being depressed and even preventing suicide because the depression leads to those kind of terrible outcomes. So this is a social approach to healthcare using blockchain to manage the access, privacy, and security of this very important data, but keeping it shared across all the people who do need to know how I'm doing. Let's go to the last 2 use cases. The first is provider payments. Physicians expect to get paid when they see a doctor. That's their revenue, and they need to run their business on a timely basis by receiving payments on a timely basis. So we have implemented a provider payment model in Care Wallet that allows me as a physician to accrue and redeem payments from insurance company, from employers, from third parties who are responsible for paying me for care that I deliver to patients. In the US, for example, programs like Medicare and Medicaid are a huge source of revenue for doctors, but they typically result in a 90-day wait cycle after I see the patient for me to get paid. Implementing real-time payments using tokens that are highly programmable and automation of payment processes really reduces the time and the effort and the cost of getting paid. And as an insurance company, I can tell you a startling fact. Many times we would spend more money adjudicating and checking the claim from the doctor than the claim was worth itself. So if you get a $20 claim, it might cost you $25 to actually adjudicate the claim, which makes no sense. This chain-centric model lets me make instant payment, and if it turns out that I was billed incorrectly, I have immutable proof that the payment was incorrect, and I can seek an automated credit from the physician's wallet. There are many use cases like this that exist in self-pay model, such as Saudi Arabia. And last but not the least is paying providers for value delivered rather than services delivered. Many of you might have heard of this notion of value-based contracts or performance-based payments or outcome-based payments. And the idea is simple but complex. The idea is that I as a physician should be paid for getting you healthier rather than having you come back 3 times and failing to treat you well. The 3 visits to the office, while I deserve to get paid for that, I really deserve to get paid when I get you well. So doing things that will get you well, such as taking all the precautionary measures and giving you the best possible care and ensuring that we're doing everything preventative to take care of your care is very important. So as a result of this, we have implemented a value-based payment model in the wallet, which allows us to track physician behavior and to reward them for the appropriate physician behavior. And this program is currently live with one of our large clients in Arizona called Arizona Care Network, who is using this program to do value-based payments to their physician network around the state of Arizona, numbering in the thousands. And in wrap up, a few words about SolveCare. We are a healthcare company, and our mission and our vision we have shared with you already. We are about a 100% company and we are growing rapidly. And our locations are based in the United States, Canada, Europe, and we are expanding into Middle East in the near future. Healthcare is our mission. Healthcare is what we do. Healthcare is where we have spent all our lives. And we are very excited by the possibilities of what blockchain can do to help reduce the cost of care, improve access to care for you and I and our parents and our children, and improve the quality and outcome of care so that we can all be more effective as a family, as an employee, and as a society. We welcome your questions and comments, and I wish you a wonderful conference. Thank you.